Oh. Wondered if that member would be present tonight.
She's sorry I missed the last one.
Yeah.
Suzanne got a new puppy. I was hoping that
Oh.
that animal would make an appearance this evening.
Oh,
Well, that would be nice to have a showing. Can
She's actually taking a nap right now with my parents in the kitchen. I don't want to disturb her, but maybe if she's awake by the end, I can bring her on.
want to describe her? So at least
I can show you a picture. She's a little Havanese. She's 3 pounds right now. She's really,
wow.
because she just looks like a little doll. That's
Oh.
just my mom's hands.
Lovely. Is that white on her forehead?
She's mostly like a reddish brown and then a little bit of black, but she has white at like her paws and the tip of her tail. So a lot of other people that have Havanese say that they all turn white. So we'll see.
Yeah, my limited experience is that they change a lot. Steve, what is your cat's name?
it depends. Some people don't like to give out the names of their cats because it's part of their passwords for various things.
Oh, I see. Okay. So just say password.
Yeah. And right now I'm going over his lines.
I see. How old is he?
Too old. He's 16, which
Oh, wow.
saddens us a bit because he's been a great cat.
How long did the other one live?
I've had a few go to 19. I never had a cat go beyond 19. Though I've known people who have had cats that have made it to 22, 23.
Wow.
We've had a lot of cats over the years.
Most of what you see of your cat is a tail.
Yeah, he's a little camera shy at times. Yeah, it's getting close to bedtime for cats who are well fed.
There's John.
Hey, how are you?
Fine. How are you?
All right. I've got a little bit of something, so my throat, my voice might not sound as crisp and clear as usual.
Well, we hope you feel okay.
I feel fine. I just last Wednesday in the evening, my voice went away and it's slowly making its way back.
Well, shall we get started? It's 6:31. Let's open the meeting. Let's do a roll call. Kay Peterson, chair, present.
Stephen Kruskal, member, present.
John Quackenbush, member, present.
Okay, and we have a citizen comment period, but we have no one here to comment, so we'll jump right in. Why don't we jump forward with our agenda, because Artie, I assume you're here for 88 Pine Street.
Yep, 88 Pine Street.
Okay. Why don't we begin with that so we don't keep waiting? And Jason, do you want to begin?
Yeah, I'll kind of set the table a little bit just to kind of reset from when we last met about this. So if the group recalls, we met back in December and discussed this project at length. Artie and his client are proposing a new well, and they are seeking relief from the requirement of 25 feet setback to a wetlands. They are looking for 14 feet, I believe, Artie.
That's
Uh,
correct. Yeah,
so
I put the plan on the screen, Jason.
perfect.
Thanks,
Everyone
Artie.
can see that, right?
Yes, thank you.
Great. So in the time since we last met, already went through the process of, went through the formal variance process, notified abutters, put together a nice letter to send to all of them, publish it in the paper, went through all the proper steps for it. So now that he's completed all that, we have the opportunity this evening to make a formal decision on it. And just to share my thoughts and opinion on it, I have no issue with the proposal. This is a tough site. Us as a Board of Health, we need to prioritize this person actually having a safe supply of running water. So if this is the only way to achieve that, then I say they should go for it. The one condition I would give them is obviously our approval would be contingent on any conservation approval, which I spoke to Janet Bowser this morning. This is going before them in about 10 days or so. I believe it's January 23rd. So
That's correct. Yep.
I would have no issue approving this on our end, assuming everything makes it through those guys. Okay.
So are there any questions from our board?
No, I remember discussing this previously.
Yes, so I would like to entertain a motion to approve the variance for this well, allowing it to be placed,
14 feet.
what?
14 feet.
14 feet from the wetlands, contingent upon approval by the Dover Conservation Commission.
Thank you.
So I so move. That way I don't have to repeat it.
Phew. And a second,
Second,
all in favor? I, Kay Peterson.
I, Stephen Kresko.
Hi, John Quackenbush.
Okay. All right, any other questions about it or comments? All right, thank you, Artie.
Thanks,
Thank
Artie.
you very much, guys. Appreciate it. Have a good night, everyone.
You too.
Thank you.
So admin's phone, who is that? Do we have a visitor? Admin's iPhone, it says, right?
It does.
It just appeared, right? So Suzanne, that's not you, right? Because,
Nope, I'm on my own account.
okay, well, maybe that person will speak up if they have something they're here to discuss. I'd like to talk about our next meeting. I would like to propose that, given that our nurse, Gail Versa, will be starting February 10th, right, Jason? February 10th? I'd like to propose that we have either our next meeting or the meeting after that in person, so that we can all meet her and all talk to each other face to face. We don't ever do that anymore, and I think we lose something by never doing it. I'm not proposing that we do it on a frequent or regular basis, but I would love to do it as a way of helping introduce her to the board and us to her. And then I'd also like to talk about kind of our roles in the town and what this means for the Board of Health now to have a public health nurse. And obviously we have Jason now. We've had him for 2 years. We're happily accustomed to having a health director. But I think this would be useful to do. That said, it may be very challenging to arrange something like that, because I think ideally it would be at least in my imagination, early in the morning so that our staff wouldn't have to be working at night to attend, and also so that maybe John, if there's a day when you could stay home a little later than usual, and then Steve and I presumably could adapt if we have enough warning. So if you all agree that that might be worth trying, we will ask Suzanne to begin to plan something like that.
You said she starts February 10th.
Yes.
So, and what time would we want to hold the meeting, Kay?
I don't know.
How
when
about
do-
this? Jason and Suzanne, when do you typically come in?
I usually get there about 8 o'clock, and Suzanne is usually in by 8:30. I mean, we're kind of open for the most part. I know, John, your schedule is probably the toughest to work around, so I think we'll maybe lean towards whatever is going to be best for you, and just work around when you could do it, if it's, of course, something you're open to.
Yeah, I'd love to. We could do it if this works for everybody. We could do it on the morning of February 12th, which is a Wednesday. And, I could be available, 8:30, 9 o'clock, whatever works for everyone.
I have the unique problem of a daughter who's scheduled for a C-section that day, that morning. And Woody and I are supposed to help deal with her kids because her husband's going to be in the hospital with her. So I'm not sure that day would work for me.
Okay.
What is it? Can I propose we just put a pin in it and hash it out, not on the meeting? Maybe
Okay.
Suzanne
Okay.
can reach out to you guys individually and see if we can coordinate something.
Yep. I'll be flexible to try to find a good time.
Okay, sounds like a plan.
And it's possible that if we can't schedule that meeting early, that we just go ahead and have our next meeting February 3rd, and then have a meeting in person maybe in March, or we'll play it by ear.
Yeah, agreed. We shouldn't force it if we can't make something work. We can always have our next meeting as planned, and then just maybe shoot for end of February or March for our next in-person meeting.
Okay, so let's move on to the minutes. Does anyone have any suggested changes? Steve, did you say no?
Nope.
None for me.
I have two minor ones, in section 8. There's a paragraph that, or I don't know if it's a paragraph, but it says, yeah, paragraph beginning, Chair Kay Peterson finds that the board needs to continue to do more research. I would change that to say, the board needs to continue to do research before developing an action plan.
Sounds good to me.
And then,
And I know you guys can't see it. Sorry to cut you off, Kay, but Suzanne is making that update in real time as we speak. I can see it
okay.
on the document.
You can see her doing that? Oh,
Yep.
because you're on Google on the Drive. Got it. Tell me when you're ready for the second.
Yep, I'm all set.
Okay, and then at the end of number 10, it's the only sentence in number 10. Just change it from flu clinic to flu/COVID vaccine clinic. That's all I have. I'd like to entertain a motion to approve the minutes
So
of
moved.
February 3rd.
I'll second it.
All in favor, I, Kay Peterson.
Hi, Stephen Questcall.
And I, John Quackenbush.
Excellent. Okay. we will move on to waste hauler renewals, number 6.
Yeah, so the reason I included that, there is a stipulation in our trash hauler regs that says in order to approve renewals, we need to do so at a public meeting. So I thought the easiest way to do it was to just present the list to you guys and just kind of have you guys give the okay. If they're appearing on the list at this point in 2025, it means that they've submitted all the required materials for renewal. I've looked at it, given my sign off, and they've been issued their permit at this point. So in order to make all that formal, like I said, I just wanted to present it to you guys and have you give the green light on it. You had a question, Steve?
Yes, in 2024, were there any complaints against any of them?
That's a great question. Not a single one that I'm aware of, other than unless maybe you want to include high prices, but there's nothing we can do about that.
And has there been a change in the number of haulers?
Nah, about the same. I mean, we really don't have as many as you'd expect. I believe my current version of the list has maybe 6 or 7 companies on it. Let me see if I can pull it up just so you guys can see it.
I've been told that it's been said in recycling committee that private waste haulers now hold 42% of the trash hauling removal business in Dover. FYI.
That's a lot.
Yeah, so here's the short and sweet list. Harvey, Cleanway, Star Waste, Wellesley Trucking, BP Trucking, JT Trash. And like you just mentioned, Steve, I want to say Harvey does probably 3/4 of all the pickup.
I heard 80%.
Yeah, so yeah, somewhere in that range. All the rest of these guys, for the most part, they do a few satellite type pickups. Like Wellesley Trucking, I believe, only services the Connor Center, so one customer.
E.L. Harvey took over for Dover Trucking, or they bought out Dover
Yes.
Trucking, which is probably where they have so much of the business.
Yeah. Okay, so do we need to vote on the approval of this list?
Probably a good idea just to cover our bases. I don't know that it's necessary, but we might as well, since we're sitting here talking about it.
Okay,
All right. So I move that we approve the permits for the trash hauling companies in the list Jason just presented.
second. All in favor? I, Kay Peterson.
Hi, Stephen Kruskow.
Hi, John Quackenbush.
Very good. So the next item on the agenda is septic hauler renewals.
Yeah, and so this is up to you guys, just kind of for consistency purposes. We just did all these renewals because they also coincide with the calendar year. So I have a whole fresh new list of septic installers too. There's nothing saying we have to formally approve of this. I just figured since we were at it, I was happy to share with you guys. So it's up to you. We can jump right over this, or we can take a look at it if you're interested. Steve?
I'm inclined not to want to approve this list because of episodes of displeasure against an occasional septic hauler or two that I wouldn't want to be on record as approving them.
And we also have nothing in our bylaws that requires us to
Yeah.
approve.
Would you put up the list anyway, Jason? I'd love to see it.
And have there been any significant changes in the list, Jason?
No, it's pretty consistent year to year. And just so everyone knows that this list that you're seeing, let me share it here. So these are all the folks who hold an active installer license in the town of Dover. So again, these are all people who have already submitted paperwork for this year, and I've reviewed and given my approval. So a lot of familiar faces, Mayo Excavating, Latazzi, Hockman, Scott Septic, a lot of the same folks we routinely see. So, again, we keep this list at the Board of Health office. If anyone is if anyone's interested in obtaining a copy, we don't recommend anyone, of course. It's simply a fact. These are the folks we license, and that's that. You're free to use whoever you wish. That's about it. Any more questions on the list or?
Well, I
ahead.
was curious, does anybody, is there anybody who really has a big share of the market here in town?
Scott,
Scott, yeah.
Yeah, I mean, I would say there's maybe 3 companies who do 95% of the work.
And that would be Scott, Atkinson, and who else?
Well, so I mean, it depends, because really Atkinson and like Scott are doing separate things. Like Scott is doing primarily installations, where Atkinson is doing 9 out of every 10 Title V inspection in town.
So I was in the Board of Health one day, and Jason happened to be involved in a conversation with someone who had applied for a license, but had not done well enough on some part of the process. I can't remember what it was, to be granted a license. And I thought it was worth noting that this is not an automatic shoe-in kind of process.
Yeah, no, it's a fair point, Kay, and what you're referring to is brand new installers who have never previously been licensed in the town before and need to pass an exam. So they have to actually take a multiple choice test, which seems almost silly, but the whole idea is for them to prove to you that they at least have a general understanding of Title V and the town of Dover septic regulations. So any new person has to take that and pass.
Okay, so shall we move on? Any other questions about this?
No, thank you very much for doing that for me. I appreciate it.
No problem.
All right, let's move on to the Board of Health fees.
Yeah, so I kind of just wanted to put the feelers out on this. As part of our shared public health services agreement, I recently participated in I guess a study you could call it, where there was a company that looked into our Board of Health fees. They basically took them all and plugged them into this big calculator and determined how our fees, compared to other towns, and are they too high, are they too low? So it was kind of an interesting process. We had a few Zooms along the way where we reviewed some of the findings, and it was just a good learning experience that I enjoyed. The folks I worked with are very, very nice. But long story short, what we found out was our fees are actually a little bit on the lower side compared to other municipalities, which I thought was interesting, because you'd kind of think the opposite. So my thought was, do we maybe look more into this and revisit upping some of our fees. That's, certainly something where I can look into further and actually come back to you guys with specific numbers and proposal type things. But it's totally up to you guys. If you guys have no plans for updating any of the fees anytime soon, then I'm more than happy to just drop it. It's just something I wanted to present to you guys and see what you thought.
How far off are we compared to other surrounding towns?
Good question, John. I'm happy to share more specifics with you guys. It really depends on, not all the fees are out of whack. It kind of depends on what it is. Like, for example, if I recall correctly, septic fees were a little bit on the lower side by like a few $100s. Whereas like the food fees are actually not super far off. They're actually pretty much in line with what everyone else is doing. So it really depends on which specific thing.
The other thing is that I didn't participate in much of this, but I did hear a presentation from the consultant who ran this program. And they also looked at the resources that go into these activities that we charge for, services, I guess, rather than activities. And I think that that was part of the analysis that led to specific suggestions about proposed fees. Am I right, Jason? That they're looking at how much time and how much basically Board of Health time goes into performing.
Yeah, actually, a lot of factors went into it. Like I mentioned, it's essentially like this big Excel spreadsheet with all these different calculations plugged into it. So they looked at time you're spending on inspections, time you're spending on review, what are your employee salaries relative to your permit fees, what are your fringe benefit percentages. All that was plugged into this. So actually really interesting, I thought.
Did they break it down by which fees are incurred by which segments of the fee paying population? For instance, whether private citizens are paying X percentage versus contractors and or developers or builders?
Good question. No, I don't believe it's broken down like that. So that's not something that we would know.
Do you have a spreadsheet from this report that would be easy for us to view, not now, but maybe between now and our next meeting, to see what some of these numbers are like?
Yes, I do have a full spreadsheet. It's actually on the meeting drive, but for ease of access, I'm happy to share it with you guys, just via email or whatever's easiest. Only reason I didn't bring it up in the meeting or present it to you guys is it has all these different pages and it's kind of a complex spreadsheet. So just for the sake of not confusing you or making things too complex, I decided not to actually share the screen and show it to you guys. It's probably easier to just look at on your own and kind of play around with it that way, if that makes sense.
Oh, where is it on the drive, Jason?
It's called Dover MHOA Permit Fee Calculator.
Okay, I'll take a look. And find it.
Yeah.
So as a general principle, I'm certainly in favor of us charging what it costs us to provide these services to homeowners, contractors, business owners, and so forth. I don't think we should be giving away our services. And I also think we shouldn't be overcharging. And I think this is a great opportunity to kind of recalibrate where we are. So we should take
individual citizens might make the argument that their taxes pay for some of our expenses, if not quite a bit of it. So they wouldn't necessarily want to be additionally burdened. While you could say that builders and developers are making healthy profits currently in their efforts in Dover, and they could stand if it increase in fees if it meets what it costs us.
Well, on one level, I get your point. On the other, historically, the agents have been paid out of a revolving fund into which the fees go. That's the way it's been done in Dover for I don't know how long. And it's only since Jason has been hired as a salaried employee that the money doesn't flow directly out of the revolving fund into his salary line, but in a sense, but there's been no change in the sense that he's on one level, he earns his keep by in the process of doing all these providing all these services that historically towns charge for.
Yeah, so rather than make excuses as to why I couldn't bring this up, I figured I would just share my screen just to give you guys an idea as to what I was talking about, just so you could believe me. So what we're looking at, this is kind of just this is not the entire list. What we're looking at is just like our different septic system permits. But if you look over on the right-hand side, you'll see our current fees versus what it thinks our fee should be. And then in the last column is the difference. So just to give you an idea, for any alternative innovative type septic system application, we charge $675. This is actually telling us that we're off by about almost double on that one. But, that kind of begs the question, do we really need to be charging people $1,200 for a septic application? That seems like a little much, no matter how you calculate it or break it down.
So it's not that complex relative to other types of assessments that we do.
Well, still, I mean, my point is, are we going to bump that up to $1,200, or do we maybe find some realistic middle ground where we beef that up
Yeah.
a little bit? You know what I
And
mean?
why is it $1,200? What goes into that?
See, that's a question I really can't answer. I was explaining the calculator portion of this before. It's all these different numbers that they've plugged into this, and those are things you can kind of learn poking around this spreadsheet, where you can actually get an idea of where that number is coming from. I had to give them all our salary budget information, vacation time, all those different things they plugged into this. So that's kind of somehow, after all that, that's the number it's spitting out. So,
Mhm.
And in this particular sheet, a number of these things are very high percentage delta. If you look at percentages rather than absolute numbers.
Yeah, for instance, the soil evaluation test pit
yep.
observation, that's again, huge difference percentage wise. Well, so you think if we poke around these spreadsheets that will get a somewhat better sense of this? And then we can
I think
talk
so.
more
And
about it next
then,
time.
maybe we can put together, what we think might be good in terms of new numbers, and we can go from there if it's something you guys are interested in pursuing.
I think so.
All
Yeah,
right.
so for instance, just off the cuff, I would say, can we find in these data, or by going back to the consultant, why they calculated $1,190 for design review of an alternative system? I mean, is there something we're missing, or is there some resource that we're putting into that we're kind of
I
not?
mean, it is a more complex
Hmm.
process, just
Yeah.
more inspection time, more time on review. So that's why that number is so high compared to others.
I see. Steve, you were gonna have something else?
I've seen Jason spend a fair amount of time in, say, being out at a site. And this does need to be amended in some form. It's just coming to a consensus in how we would amend it.
Yeah.
So we previously had people who contracted to do the well inspections, the septic inspections. Do we know if they were charging different amounts for different different types of systems, different situations?
I would
So-
say it wasn't as systematic as this by a long shot.
Yeah.
So 10 years ago, it was the Wild West. When
I would
George Junta was.
Yeah, so I don't know for certain, John, and I don't want to say anything too negative here, but my understanding was a portion of every permit that was coming in, septic or well wise, was going directly to the agent.
Yeah.
So it's unclear how much those permits were in some cases, just in terms of total cost. So you know, I don't, the way we're breaking everything down right now, obviously everything is 100% going to the town. We don't have any more of that guesswork or anything anymore. It's one number and that's it. It just goes to the town, no percentages or anything like that. But everything used to be broken down. It was very messy and convoluted.
Yeah. So I'm pretty sure we do, but I want to check anyway. Is there anything that prohibits us from raising or changing the fee structure? Or would we have to take this to the select board or even to a vote in the town?
I'm gonna have to double check, but I believe it's as easy as just a board vote, and we can change.
Yeah, I'm pretty sure it is too. Yeah, if you could share this, that would be really good. I can't find it on the shared drive.
Yeah.
So sending it via an email packet might be helpful.
Yeah.
Yeah. Oh yeah.
Yes, yes.
Yeah. Let me. If you guys are done with this now, I'm gonna stop share and I'm gonna see if I can send this to you.
All right.
Okay.
Thank you so much.
And do we have a deadline by which we need to do this?
No, I mean this is just. I mean, whenever we can get to it, if we think this is a priority, then we can do it anytime.
I guess the other, if we think about this sort of planning finances, do we know typically how many of each types of inspection the town does every year? You do, Jason?
That's in the town report that you
Well,
drafted.
okay, yeah.
but what John is saying is, you're talking actual like boots on the ground inspection type thing, right?
Well, for everything we charge fees for.
Yeah, I mean all the permits obviously we keep track of.
Yep.
But in terms of actual times, like I've been out to a particular site for, you know, whatever the inspection may be. I log them, of course, but I don't actually go through and tally.
All right, that's fine.
Which isn't a bad idea. That could certainly be something I could do, but
I don't think it's absolutely necessary at this point.
Does the information on the town report correlate with the categorization that you just showed us?
in terms of how things are broken down,
In terms of the numbers, and not so much the numbers, but the titles of each fee.
Not necessarily, because my goal with the town report was I wanted things to be as clear as possible, because the way we used to do it on the town report is we used to break down all the different septic permit types, fast systems, Elgin systems, all those different types. But you have to know who your audience is. And if it's the general public, I wanted it to be as straightforward as possible. So I kind of, if you look at our report, I did my best to break things down in an easy to understand manner. I didn't want to get too bogged down in the super detailed stuff, if you know what I mean.
Is it possible that you could provide us a list in financial order of the 20 most commonly paid fees in terms of the aggregate amount of money and that would be involved, therefore, for a certain type of permit?
Well, that's going to depend on what the actual fee is, right? If I have the town report draft open, and the clear winner is Title V inspections with 88.
Yep.
But that's a relative, if I remember what was on the list, it's a relatively low cost permit.
Yeah, it's $50 review fee. So, whatever that quick math is, 88 times 50.
Yeah. It's not going to be a whole lot of money.
Is that what you're meaning, Steve? Are you saying?
Yes, I'm just interested in terms of if you raise a fee and there's some question as to whether to raise it or not, and it's only going to yield the town an extra $500.
Yeah, no, that's a good thought. Because I mean, while we're on the topic of town report, if we had 23 septic applications last year, they're all at minimum 550 and they go up from there. So, whatever that final
That's
number is.
yeah. So that's sort of a useful thing in terms of deciding on certain fees.
Yeah, that's a good idea. Actually, I like that. That would be interesting to see.
Well, I don't know, again, how that breaks down between the more complex systems and simple gravity fed systems, right? But with 23, 23 septic system permits, right, raising the fee by $500 is going to bring in,
Over
$11,500,
Yeah.
right?
No.
So it's not huge, but it's not nothing either.
And the other thing that's, I think, important to think about is that if we let our fees stay low and they get lower and lower relative to the actual cost of delivering the service, then we get farther behind and the problem compounds.
Yeah.
And there's something to be said for keeping up with the cost of delivering the service. And I like the fact that we have some benchmarking here that pegs the service to what the actual cost is, which doesn't mean I think we should suddenly raise somebody's fee by 200%, but I think we should be moving in the right direction with each one in general. I just wanted to say something else, and I have this vague recollection that there's something in the Blue Book every year about Board of Health fees. Does anyone else recall this, and that they're actually listed, or is this a delusion on my part? Well, we'll find out. I'll ask Woody later. So our plan then is for Jason to send us an email link to this file, and we'll all take a look at it. And if we have questions, which I suspect we will, we'll direct them at Jason, and he'll try to help us understand the document, and then we'll discuss it more at our next meeting. And in the meantime, Jason and I will figure out whether we have any obligation to do anything about this relative to the warrant, hoping we don't. And if we do, then we might have to accelerate the process a little bit, but otherwise we'll talk about it at our next meeting.
Sounds good.
Okay, anything else about Board of Health fees?
Yeah, actually, real quick, John, I misspoke before.
Mhm.
When I go out and do inspections, I actually put it on the calendar, our Board of Health shared calendar, if you're ever curious. So that's my way of logging and tracking all that. Just that way it lives in the calendar forever. You can always go back and tally them or verify, I did such and such on a certain date. So we all have access to that calendar. So you all have the ability to look at that and see where I've been or what I've done if you're ever curious. So that's kind of my system that I utilize to help me, log things and stay on track.
Yeah, that's very helpful, Jason. Thank you.
Yeah, of course.
Actually, I want to add one other thought to this. This is a bit tangential, but once we have Gail on board and once we are able to give vaccines and bill for them, this is all going to take months to arrange at least. We will start charging for vaccinations rather than outsourcing them to CVS and having them charge, or outsourcing to whichever pharmacy. And those will be a whole different category of fees coming from the Board of Health. And we will probably need to amend our revolving account because of that. Jason's had a conversation both with Mike and with Carl Valenti about this, and it's complicated, and I don't think there's any point to talking in detail about what it might entail, because I'm not sure we really know yet, but this is just to let you know of something else that's coming down the pike. All right, shall we move on to talk about the budget?
All right.
So budget fiscal year 2026, as we do right around this time every year, just looking for your guys' formal approval of this. Something we've already finalized in the office. I shared with you guys, I don't know, we're probably going back to November at this point. So you've all had it in your possession and have hopefully had an opportunity to see it. There's really not much on here noteworthy in terms of changes. Gonna see about, I believe it's about a 7% increase overall just from employee raises, in addition of a new employee and their raise. Beefed up one or two of the lines just to accommodate for Gail. And I mean, by beefed up, I'm talking like $1,000, not anything groundbreaking. So we added office supply line, medical supply line. And really the only other thing that's happening that's noteworthy is, if you guys recall, we were given $50,000, say 3 years ago at this point, to accommodate for our nurse. That's been living in our professional services line for the last few years. Now that we actually have her on the books, on staff, that $50,000 is going to be moving to our permanent staff line. So really that's the only big thing that's going to have to happen for this budget. Other than that, there really isn't much too crazy on here. Do you guys have any questions or thoughts on this before we move it forward with the rest of the town?
Nope.
I would just say that we did talk at one point about requesting funds for a refrigerator for vaccines, but we're going to wait on that because we think that so Sherburne has a full setup for vaccine refrigeration, and we're, at least to start, we can share their facility and not have to lay out any money.
Seems like a wise and prudent approach.
So you don't want to use the legions of refrigerator?
All right, are you looking for a motion, Jason, to have us approve the budget?
Please, but I will have to have you actually physically sign it at some point, Kay, but we should at least still give our approval at the meeting.
Okay,
So I move we approve the budget as presented. Budget request is presented.
Second,
all in favor? I, Kay Peterson.
I, Stephen Kruskal.
I, John Quackenbush, as long as I can speak.
Your voice is rapidly deteriorating.
And I did eventually find the permit fee calculator, Jason, so it was there.
It's your altered state from your infection. All right, moving on. Radon detectors.
This made it to the level of the agenda item. And basically, I was hoping to provide as a service to individual citizens in the town the ability to borrow a radon detector rather than to purchase one if they'd like to check for radon in their homes. I don't think the library has one, and it's certainly okay if it was a library that served that function. But it's in my experience with a library that when looking for certain items, that the weights have been inordinate. So having it within the Board of Health as a borrowable item makes a little more sense to me. And certainly people should be checking their homes for radon.
So it seems to me that the last time we did this, it was not expensive to buy a kit from a company.
I don't think it's overly expensive. It's just that there's a certain amount of bother and there's a certain amount of ease for people just to borrow ours, as long as it doesn't take up too much of our time.
And do you know how easy or difficult it is to make sure that ours stays accurate? I mean, how do we test if we have one that we're lending out? How do we test?
Well, I guess we do a research as to which is the most reliable, but we've had one in this house for a number of years, and we haven't questioned its accuracy.
Well, I feel like when it's the Board of Health offering an instrument for a loan, that we have to be sure that it's accurate. But we can read about that and see what we can learn.
Do you know what the cost is?
No, because ours was given as a gift.
So, if I'm not mistaken on this, I believe you can get free testing through Mass DPH. So a lot of health departments around the Commonwealth, if you Google it, you'll see they have messaging on their respective websites that kind of just give a little summary of the free program and just give a little bit of information on it. Provides the contact for obtaining the free test. So if this is something we're interested in pursuing a little bit, I think that may be a good route. Just maybe get a blurb up and link it to that free testing information, just to kind of get a little bit more awareness out there on the radon, and just give people in Dover a little guidance and more assistance on it.
This would make a good banner for our print. Because it's never going to go away as a problem, and we could always link to something with a banner, and we could also put something in the town newsletter and have something on our website. whatever else.
Let Suzanne flex her artistic muscles.
Yes,
I'm happy
So-
to.
maybe we should do some more research about this and then,
I just looked it up. You can, from November through March, get a free radon test from the DPH.
did you say from November through March?
Yes, during heating season.
Oh,
It is, and how does that actually work? Did they bring somebody into the house, or they send you a detector? Or?
I think they send you a detector and you have to send it back.
and why is heating season a bigger problem?
My only guess would be that, there's less likelihood that the house is, people have windows open.
Oh, yeah, yeah. The house is closed up. That's
Yeah.
probably right. So one of my hopes is that Gail will be able to help us do some educational campaigns with topics like this.
Yeah, no, I think this was a great topic on Steve's part. I think if we can at least start to raise a little bit of awareness and get some messaging out there, I think that would be a big help for sure.
Yeah. How much sense do you all have that there is a significant radon problem in the town?
I think there's been some remediation done in this town. I mean,
House
there
by house, you mean?
are houses have noted that their levels were higher than optimal and
Yeah.
have sealed their basements.
Yeah, we have a radon mitigation system in our house.
Now you both have me worried.
Well, testing is not required, but
Yeah.
when properties change hands, and I don't know why ours was tested. It was done before we bought the place, but we repeated the test and with the fan off, and it was positive. Anyway, we shouldn't get too much in the weeds in this, but it's a really interesting problem. And Steve, I'm glad you brought it up. We can figure out a plan. Anything else about that? Should we move on to tobacco? So, I initially put this on the agenda because precipitated by Needham passing a bylaw at the end of December about this nicotine-free generation concept of their bylaw that they passed requires that tobacco vendors not sell to people who are born after a certain date. I can't remember what their date is in Needham, but this is mimicking what's happening in a number of other municipalities. And I guess Brookline was the first municipality to enact something like this in Massachusetts. And I don't know if you saw today, did you get an email from someone named Anthony Ishiak?
Yes.
Yes.
So I used to work with Anthony years ago, and then he became a member of the Brookline Town Meeting and got involved in public health policy and got involved in this first in the nation bylaw to prohibit tobacco sales to young people below a certain age. And they're pushing now, and he just coincidentally wrote today to urge us to think about enacting something like this in Dover. I don't know whether it would be useful to have him or somebody who works with him come and talk to us. Or we could have somebody from Needham come talk to us. Or we could just talk about it on our own, whatever we like. We don't have to make any decisions. We're not going to make any decision today, obviously. If we did something like this, we'd need to have a hearing we don't need to write a proposed bylaw change and so forth, but I'm interested in kind of taking your temperatures about this, seeing where you think we should go.
Should we go further on this, we should be very careful to make sure that it's well publicized rather than in the weeds.
Mhm.
No pun intended.
Sorry, I missed that.
I think it's actually worth looking into. When I read the stuff that he sent, I was pretty persuaded by the results that they achieved in Needham.
Yeah, it's pretty
Yes.
compelling what he sent us.
Yep. I mean, a
Yes,
50% decrease in high school smoking.
yeah,
I don't know how prevalent it is in Dover Sherborne, but decreasing it all is going to have a positive effect on the young people in town.
I may have misread this, but somewhere he said, I thought that we have a 22% tobacco use rate in young people in Dover. I don't know what that's based on, but be interesting to hear more about that.
Yeah.
I would like to, I think that it would be great to go forward with this once Gail is on board, and
Yep.
I feel as if this is a great area for public health nurse to sink her teeth into. And I also think it would be a great opportunity to collaborate with the school nurses, perhaps anyway. I have no idea what they do about smoking there, but I think it'd be potentially a good way for collaboration. Well, how about we wait till Gail's with us and then we think about setting up a meeting and inviting Anthony or somebody else to come talk to us?
I'd love to, it might be really interesting to have Anthony come and present this.
That might be the meeting that we have that's open.
Yep.
Oh, you
in
mean
per-
in person?
in
In person?
person.
Yeah, yeah.
That's a really good idea.
Okay, anything else about that subject? Any other old business?
None for me.
Jason, was there something else you and I talked about, or did we get to it? I think we got to it earlier.
You wanted to mention the revolving funds, but I think we already covered
Yeah,
that.
we already did that. Yep. Okay. So if we can adjourn really fast, we'll be done in slightly less than 60 minutes.
I move we adjourn.
Second,
All in favor, I.K. Peterson.
I, Stephen Kruskal.
I, John Quackenbush.
All right, 7:30.
All right.
Thanks, everybody.
Bye, everyone. Have a great night.
Great discussion. Thank you.
Thank you. Thanks for all your hard work, Jason and Suzanne.
Yes.
Our pleasure.
Good
Have
night,
a great
everyone.
night.
You too.